back to Antibiotics and Overview Part 3. For this one, I'll be going over linezolid, metronidazole, sulfamethoxazole, and trimethoprim combination, and then just a summary over the antibiotics. So what this lecture is supposed to kind of go over is just sort of like high yield indications for the PEBC and some adverse drug reactions to kind of like help with your study. So usually include this slide with the previous two, and it's just kind of for your reference of what kind of bacteria that the antibiotics target when I say something like gram-positive, gram-negatives, atypicals, and anaerobes. Just a quick review. So gram-positive, so the reason it's colored blue and purple is because this is the color that the gram stain will show if it's gram-positive, and then gram-negative is going to be red and pink. Atypicals will typically be colorless. Atypicals will tend to be like your pneumonia or will tend to be like your pneumonia infections, and anaerobes will tend to be like your GI or GU infections as well. And as I said earlier, so we're just going to go over like the high yield indications, adverse drug reactions, and then anything special that you might need to know about the medications. So let's go into the first one. So we're going to go over linezolid, and this one's a very broad spectrum. So it treats anaerobes and gram-positives, including MRSA, and in some cases, there's been shown to be better than vancomycin in MRSA pneumonia as well. It's also good for vanco-resistant enterococcus. Just to add on to the MRSA pneumonia is, sorry, just to add on for the vancomycin-resistant enterococcus, you can also use daptomycin and tigecycline for vancomycin-resistant enterococcus. Um, but for daptomycin, you can't really use it in MRSA pneumonia, and this is because it's inactivated by those lung surfactants, so it's not effective in that regard. Some adverse drug reactions is to keep in mind that it causes serotonin syndrome and hypertensive crisis if it's an interaction. And the reason for this is because it's a reversible monoamine oxidase inhibitor. And so those are very well known to cause a hypertensive crisis when it's causes serotonin syndrome. Um, a common thing they usually ask is uh, which foods to avoid in monoamine oxidase inhibitors. And that would be like tyramine, which is like old cheese and wine. But you don't have to worry about in this one because this one is a reversible one, not an irreversible one. So it also causes blood disacchariasis, which includes like thrombocytopenia, anemia, and leukopenia. So that's why it's really important to perform complete blood counts if you're using it longer than 2 weeks. It also decreases the Caesar threshold and causes hypoglycemia, and it's best to avoid this in pregnancy as well. Okay, so we got metronidazole. This one's usually used to treat GI and GU bugs, such as Giardia, Trichomonas, C. difficile, and I just wanted to add that you only pretty much use it in mild cases for C. difficile, not moderate to severe. That one's more reserved for fidaxomicin and vancomycin. Also, I'll just add here that the treatment is usually 10 days because often the PBAC wants you to know that it's for that many days. Uh, and you can also use it in H. pylori, usually in quadruple therapy. I can't remember off the top of my head if it was used for triple therapy, but yeah. So it has got very good activity against anaerobes. Um, so some adverse drug reactions is it cause abdominal pain, nausea, metallic taste. Usually whenever you see abdominal pain and nausea kind of goes hand in hand with this one. And same with the metallic taste, so that can be unbearable. So some patients causing a little bit of nauseous. Probably the most important one you need to know is diaphragm-like reaction. So we tell them to avoid alcohol during and 1 to 3 days post therapy as well. Rare side effects, you don't really need to know these, but it's just there for completeness, is peripheral neuropathy, seizures, and encephalopathy. Best to avoid this in early pregnancy as well. Sulfonamides. So this is a sulfamethoxazole with trimethoprim, and I just kind of put the dose there because sometimes it confuses people which one is which. So 800 is usually in referral to the sulfamethoxazole, and then ooh, trimethoprim is usually the 160. So it covers a wide range of, oh, that's in the way, isn't it? Let's move that out of here. Covers a wide range of gram positive and gram negatives, including MRSA, which is really important. So indications you can use this for is UTI, sinusitis, and pneumonia jirovecii. And pneumonia jirovecii is usually seen as a opportunistic infection. So you'll mostly like see that in HIV prophylaxis, where they're kind of taking a sulfatrim DS tablet daily. Oh, actually, I don't think it's sulfatrim DS. I think it's the lower dose one. But they would take that one daily for prophylaxis. Acute otitis media, which is basically ear infection, traveler's diarrhea, and Shigella. Um, if anybody remembers traveler's diarrhea, another prophylaxis for that one is azithromycin as well. And then also some skin infections. So you typically want to avoid this in sulfa allergies, which is pretty obvious. You also get rash, diarrhea, hyperkalemia, and it can affect the level of immunosuppressants as well as renal impairment. But you also get photosensitivity, and that's usually because of the trimethoprim component as well. Um, I don't have it listed here, but it can cause hypoglycemia when given with other sulfonylurea as well. Um, it's also got the anti-folate activity, so you want to try to avoid this in pregnancy, especially in the first trimester, and you also want to avoid this in caution with folate deficiency anemia as well. The exception for the pregnancy rule is P. jirovecii. Like I said, it's a very opportunistic infection, so you want to use that in all throughout pregnancy as the benefits outweighs the risks with that medication. Okay, so this is just kind of a summary from all the antibiotic overviews. So this one will gonna go over um, some kind of key topics to kind of like organize what I've said. So the first part is the MRSA and MSSA coverage. I just included MSSA coverage in there because, but really the key component you want to know is which ones cover MRSA. Obviously, if you cover MRSA, you can cover MSSA, which is methicillin susceptible Staphylococcus aureus, and MRSA is methicillin resistant Staphylococcus aureus. So you got your vancomycin, linezolid, ceftaroline, which is that fifth generation. Remember, it's the star of the show, and a star has 5 points. Doxycycline, sulfamethoxazole, trimethoprim, daptomycin. Remember, daptomycin you can't use in MRSA pneumonia because it'll get inactivated by the lung surfactant. And then you also have clindamycin as well. So there's not really a mnemonic that I can give that would help you remember because a lot of them just are just they're kind of weird. Like something like Lynn drove her van to pick up her dog named Dapto or something. But there's a lot of mnemonics out there. But usually the kind of the best way to kind of know this, it's basically how I remember it is basically it's the 1% of your drugs that do the work. So these are kind of like the individuals that are like at the top of their respective class. So like vancomycin, basically I don't think a lot of people know the other ones in its class, but that's the top one in its class. Linezolid, again, it's kind of like one of the only ones in its class. Ceftaroline, pretty much the only fifth generation cephalosporin. Doxycycline, although there is the other two tetracyclines, like tetracycline and monocycline, doxycycline is kind of like the key star player of that class as well. And then sulfonamides, again, a lot of people only just remember SMX TMP. And then clindamycin, I'm pretty sure clindamycin is the only one in its lincosamide class that's, well, at least used in Canada anyways. But yeah, so I try to remember it as like the most one. If you're gonna remember any of them, kind of just remember Vanco and linzolide. I think those are probably like the ones that come up the most often. Um, the other ones you might see sometimes. Uh, Doxy barely has any antibiotic resistance, so I think it's a really good choice as well. MSSA only, so you kind of want to use either cloxacin or cefazolin if you can in those cases. Um, Ampicillin has high resistance, so it won't be effective against MSSA. So anaerobic coverage. So remember, these tend to be like your GI or genitourinary infections. So that includes your clindamycin, your amoxiclav, metronidazole, piptaz. carbapenems, fluoroquinolones, generation cephalosporins, notably the cefoxitin and cefotecan. If you remember those ones, that was the mnemonic two furry fox drink tea on the floor. So that one's the T, and that one is the fox. Atypical coverage, so that's kind of like your pneumonia, maybe STDs. And these are pretty much your three amigos. So that's like your fluoroquinoline, macrolides, and tetracyclines. Um, I don't know why I always just think of them as the three amigos because it's kind of like the ones that stand out between beta lactams and cephalosporins. It's like your fluoroquinones, macrolides, and tetracyclines. It's like the most common ones. Um, Next is the Pseudomonas coverage. So you got your meropenem, imipenem, and the reason I start it is because remember, um, pretty much all the carbapenems have Pseudomonas coverage except E, which is entipenem. And then you got your azithromycin, ciprofloxacin, levofloxacin. Moxifloxacin has zero activity against Pseudomonas. Aminoglycosides, just so you know, it's used as adjunct. Sorry, that should be an S, not a D. So it's usually as just adjunct therapy, so it's not usually used as monotherapy. Then you got your piptaz and cefepime and ceftazidime. Um, Piptaz, this is just kind of like maybe it'll help you kind of remember it, but Piptaz is like that one drug I always kind of forgot what it was used for, and I always confuse it with MRSA. But Piptaz, I kind of eventually just ingrained it into my brain that it covers Pseudomonas, and I try to remember it because it has P for Pseudomonas. Um, just a small way of helping to remember it, because Piptaz is like one of those ones you rarely see as well. Like they're only used pretty much in severe cases because it's IV. And then some antibiotics that don't need renal adjustment is your doxycycline, azithromycin, linezolid, and clindamycin. And antibiotics that have a high risk of C. difficile infection, this one's kind of easy to remember because they typically start with the letter C for and which is for the high risk ones. So that would be like your clindamycin, cephalosporins, carbapenems, fluoroquinolones including ciprofloxacin, and then aztreonam. And then your moderate risks are your penicillin, macrolides, and sulfamethoxazole and trimethoprim. And then no risk would be nitrofurantoin. If you remember, nitrofurantoin is one of those. If you watched my UTI lecture, nitrofurantoin is the one that only kind of localizes to the bladder and it doesn't move anywhere else. Drugs with seizure risk, carbapenems, especially imipenem, that's probably your biggest one that'll cause seizures. Penicillins can, cefepime, rifampin, and ciprofloxacin, but if anything, I would just kind of remember imipenem probably the most. Drugs that prolong QT, that's your macrolides and fluoroquinolones. That one would just kind of have to be straight memorization for the prolonged QT intervals. Drugs that cause photosensitivity, that's your fluoroquinolones, tetracyclines, sulfamethoxazole, and trimethoprim. Okay, so that wasn't too exhaustive of a list of antibiotics overview. I was trying to go over kind of like the main points. And again, like this lecture will probably not be current in a few years as well because like everything, medicine is always constantly changing. New antibiotic resistance could appear, for example, or maybe new side effects start to become more prominent. Who knows? But it's just sort of to give you, a rough idea of like what you can remember for the exams and hopefully do well and pass that dreaded PBAC exams and get your license. So thank you guys and good luck on your exams.